Hi, everyone, and welcome to the Self-Care Forum podcast. I'm your host, Dr. Cedric Badgetu, and today we are joined by none other than Dr. Sharita Warfield. She joins us to discuss diabetes and lifestyle medicine. Dr. Sharita Warfield is board certified in emergency medicine as well as lifestyle medicine. She was born in Detroit, Michigan, went on to attend Wayne State University School of Medicine, and did residency training at Howard University. To date, she's been practicing emergency medicine for over 23 years and is passionate about the care her patients received. Her work saw her voted as one of Houston's top 25 women in 2011, while she and her husband, Dr. Brett Warfield, were voted one of Houston's top 50 Black health professionals in the year of 2014. She is the first physician in her family, a wonderful wife and mother to 4 beautiful children. Dr. Warfield is also the creator of a podcast called The Trim Den. In addition to being the author of a book, Get Informed, a guidebook for recently diagnosed diabetics and their loved ones. Dr. Warfield, I want to thank you for joining us for this important conversation on diabetes.
Thank you for that wonderful introduction, Dr. Cedric. Thank you, and welcome to all the beautiful people who have joined us today and who will be joining us virtually. It is indeed an honor and a pleasure. I always never pass up the opportunity to talk and to educate the masses on the importance of treating and living with diabetes properly. So thank you very much. Hopefully, this interview and this recording will be well received, very informative to you, and you walk away with something, some little tidbit, something you didn't quite know or fully understand prior to today.
I'm sure we will. But before we get deeper into diabetes and everything, I just wanted to know a little bit about you and your background. So, we mentioned that you were born in Detroit, Michigan. But I want to know what inspired you to pursue medicine in the first place?
Well, I tell you, my aunt and my godmother were both nurses. And so they inspired me in the sense of going into the healthcare profession. I thought, well, maybe I'd try and be a nurse myself because I had a genuine love for the sciences as well as a fascination with the human body. I actually knew ever since the 5th grade that I wanted then to become a doctor. I thought nursing at first, but then I said, why stop there? Just, go a little further. And so being a doctor was what I wanted to pursue. I had entered a science fair way back when. My mom had bought me this like Invisible Man science project it was invisible, but it had the bodies and the body parts and the organs and different things that you had to put together. And then I did that, entered it into the science fair and came in first place. And so I guess you could say that kind of solidified, okay, yeah, I can do this. Along with just, again, wanting to help people, always, putting that best foot forward and wanting to see, positive outcomes, when I could do it. So I just thought being a doctor would be a way to do that. Also, I had gone to the ER with one of my neighbor's sisters, and I was just so enthralled by just what was going on, all they were doing and how they were scurrying around and everything. And I was like, oh, I like that. And so, being from inner city Detroit, single parent home, I wasn't supposed to be here.
Right.
Let statistics tell it, right? But I had a drive and determination that I knew this is what I was destined to do.
Well, that's 2 key ingredients that can change anybody's future: drive and determination instead of excuses, right?
Absolutely.
Absolutely. And so, in your bio, it says that you're board certified in emergency medicine as well as lifestyle medicine. Now, I'm sure I'm not the only one who's sitting here wondering, okay, we know emergency medicine, but what exactly is lifestyle medicine? Could you elaborate on that, please?
Yes, sir. So lifestyle medicine is the practice of medicine that studies on the prevention and or slowing down of the development of chronic diseases. Many of the chronic diseases that we suffer with, right, are due to a failure. Okay, so we focus on 6 pillars of health. And if these 6 pillars of health are aligned with or in line and carried out, then it leads to a healthier individual.
Mhm.
So basically, the 6 pillars are diet and nutrition, physical activity, stress management, social connectedness, sleep health, so making sure you get enough sleep, and then also toxic substance abuse or misuse. So we focus, is evidence-based, lifestyle medicine is based, and we focus on a whole food, predominantly plant-based diet, along with adequate physical activity based on your age and your ability. Again, getting enough sleep, 7 to 9 hours a night, which a lot of us don't. Figuring out how to de-stress and you can't live a stress-free life, but you can find those moments where you can exercise self-care and meditation, yoga, and what have you. To do that. And then decreasing the amount of toxic substances that you use, smoking, drinking, drugs, those kind of things, toxic relationship behavior. So we look at those 6 pillars, which are also lifestyle habits that end up getting a lot of us into trouble with these chronic diseases, obesity, diabetes, type 2, hypertension, cholesterol, strokes, heart attack. And we counsel the patient on a better way to go about living a healthier life.
So it sounds to me like what you're saying is a lot of these chronic diseases, the one we'll be discussing today is diabetes, but a lot of these chronic diseases are lifestyle diseases.
Oh, absolutely. Absolutely. Definitely with, obesity, it has now been declared an epidemic. Right. It's a chronic disease that's been now declared an epidemic. And we all know that obesity is directly related to our lifestyle, right? The amount of foods that we eat, everything is supersized now. The type of foods that we eat, everything is processed and full of sugar and salt, sodium, the times that we eat, and then our lack of exercise or physical activity. So it might be okay to eat some of those foods, but when you couple that with a decrease in physical activity, you don't burn as many calories. So you're not utilizing the food that you're taking in, it ends up getting stored as fat, and then that's a whole cascade of other problems. Same thing with sleep. Sleep has been shown to cause, a lack of sleep has been shown to cause weight gain, a bunch of other problems. It induces further stress. Stress in and of itself is, inflammatory to the body. So we, again, think that all of these things together, if you change your lifestyle, certain habits and things that you normally do that are considered harmful, then you end up with a better outcome. You can either prevent certain chronic diseases from happening or reverse some of the chronic diseases, preventing some of the complications and all of that by making certain lifestyle changes.
Oh, I love that. And it's very interesting. You use 2 words, prevent and even reverse, which isn't commonly used in, the traditional practice of healthcare. What you often hear and see and experience are treatments, right? And we'll give you a pill, which will treat the symptom, but you rarely ever hear of an emphasis on, hey, you need to change, this lifestyle habit. You need to change this dietary habit.
Right.
And so it almost seems like it's putting the responsibility on the individual.
Absolutely. You definitely have to be intentional about your own health. It's so easy to, I can eat this, I can eat that, I'm diagnosed with this, or I'll just take a pill. Well, modern medicine and the way we were all trained, yes, it is. It's reactive medicine. So we react to once you've already gotten the disease and you're experiencing the symptoms, like you said, we give you a pill and we treat you. And you take the pill and you go on, but you still have the disease. Lifestyle medicine looks at the root cause of the disease, and we try and attack it at that level, and kind of walk it back.
Wow. Now let's narrow that down into the chronic disease of the day, which is diabetes, otherwise known as sugar in some households.
The sugars.
So in your own words, what is diabetes? I mean, because we often hear it linked to sugar, but what exactly does that mean to the average person?
So diabetes, there are several types of diabetes. We have a tendency to loop them all under the umbrella of diabetes, but there are several types. So there's pre-diabetes, which, and a lot of people, when you go to your doctor and they say, oh, you're pre-diabetic. Well, what does that mean? Do I have diabetes? Not yet, but almost. Meaning your sugar is higher than normal, but not high enough to be declared a diabetic yet. And quite honestly, if you're diagnosed with prediabetes, that is the best time, the best opportunity to be able to make, the lifestyle changes and affect your outcome, where you either delay or prevent the development of type 2 diabetes. So, okay, prediabetes. Then there's type 1 diabetes, which is also known as juvenile diabetes or early onset. That is when your body does not make insulin. So your beta cells, which are in the pancreas, don't make insulin. So they have to have it injected, right, in order to live. You need insulin to live, and I'll explain that a little further down. But that's what type 1 or juvenile diabetes is. Type 2 diabetes is adult onset diabetes, right? So usually that happens as we get older. With juvenile diabetes, it usually happens in younger people. It can start in early, like 7, 8 on up to in their 20s, right? But now, because with the onset of obesity, we're seeing a lot more younger people develop type 2 diabetes. And it's not necessarily because their body is not making insulin. Type 2 diabetes is because you have insulin resistance because your body no longer responds to insulin as it should. Wow. Right. And I'll explain that. And then lastly, gestational diabetes. So you have pre-diabetes, type 1 diabetes, type 2 diabetes, and then gestational diabetes, which is only found in pregnant women, right? And it goes away after delivery of the baby in the placenta. But it puts you at increased risk for developing type 2 diabetes later down the line. I actually had I'm a type 2 diabetic. And I had gestational diabetes with my last child, and then it went away. And 5 years later, it came back. And so that was also another motivation for me writing this book as well.
Wow.
Go ahead.
No, you mentioned that was also another motivation. What was the other?
Oh, my mom had type 2 diabetes and ended up suffering from many of the complications. So she smoked, growing up, all my life growing up, but she had type 2 diabetes. And I guess, at some point she stopped taking her medicine, unbeknownst to me. I didn't know until after the fact that she had stopped taking her medicine, getting busy with the daily in and out of raising 2 young girls by herself. And, we as women are often guilty of taking care of ourselves last, right? And so she ended up losing her eyesight at 57. She lost both her legs to amputation, and she lost her kidneys. And she suffered with that for 11 years before passing away from complications of diabetes. So her story definitely was motivating for me to come back and do what I needed to do to hopefully prevent it from happening, but it ended up happening anyway. But that goes along the lines of the genetic thing, which we'll talk about. So yeah, that was another motivating factor, because I recognized that there was a need. Okay, so maybe she didn't know what foods to eat or, what medicines to take, the medicines and the importance of taking the medicines. But I find that a lot of patients and a lot of our people in our communities of color are like that as well. You get the diagnosis in the exam room, you leave. Now what? They don't know what to do.
Now what?
The right foods to eat, the right snacks, the right time. Should I lose weight? Shouldn't I? Oh, I can just take the pill. I don't have to do nothing else. So many different unanswered questions. And then, like you mentioned earlier, a lot of people are afraid to ask those questions of their doctors. You shouldn't be. I implore you to ask as many questions as you can before you leave his or her office, because, there's no such thing as a dumb question if you don't know the answer.
Right.
And with a new diagnosis like diabetes, in many cases, people don't know the answer.
And there's also a lot of conflicting information. I think it's,
Yes.
it's kind of disheartening for someone who's just been hit with some new diagnoses, which is going to turn
Right.
the world upside down.
Hmm.
And you're supposed to go out there, especially if you're not in healthcare. And so where do you begin to even ask questions? If you go on
Right.
Google and you get a million websites
Exactly.
telling you to do this, do that. So I think it can be overwhelming, which is why I'm glad we have you here to
Hmm.
really just, demystify, the
Yes.
diagnosis of diabetes in itself.
Hmm.
So we touched upon the different types of diabetic diagnoses: pre-diabetes, type 2, type 1, and of course, gestational for pregnant women. So let's look at, the pathophysiology, if you will, of diabetes itself. What causes it? What is going wrong, or what is going on in the body with the insulin for it to not work like it should?
Okay, so insulin is the gatekeeper, if you will, to that takes. So you eat a meal, you get glucose and carbohydrates from that meal. Well, your body, your cells, your individual cells need that glucose for energy. Each individual cell in your body needs glucose for energy to help you, for the particular cells or organs or whatever they're destined to do to work. And so insulin, like I said, is the gatekeeper. So when you take in a meal, you have this glucose surge in your bloodstream. The insulin allows the um, glucose into the cell, right? After it is bound to the receptor, the insulin receptor, then it allows the glucose to come into the cell. Well, when your body doesn't make insulin, right, then the glucose can't get into the cell. So then there's a buildup of blood sugar in your body. That's type 1. When you make insulin, but your receptor, so you have insulin, your receptor no longer works. It stops working because it's been down regulated, because that's why type 2 develops over time. Because as we eat and eat and eat, your body signals insulin to work. It's letting in as much as it can. Then it gets overworked and it gets overloaded. And the receptor just shuts down. I'm done. I'm not letting anything else in. Well, when you develop insulin resistance, because the receptor won't let anything in, right? Then you get a buildup of sugar. And so that's how you get those elevated glucose levels, right? And so that's what happens with diabetes. Type 1, we don't have enough insulin, so we have to inject it in for it to work. Type 2, you have insulin, but the receptor is not cooperating properly. So then you can't get the glucose into the cell for it to work properly. And that's where all your problems start.
I see. So
Mhm.
insulin seems to be the key factor in this whole diabetes diagnosis. Am I right?
Yes, so to speak.
Okay.
It really is. It's a whole carbohydrate toxicity kind of thing
Mhm.
for type 2. And we focus more, type 1 is equally as important. But again, the only treatment for that is insulin for life, endogenous or injected insulin for life.
Mhm.
Yes, you can modify your diet and do all that, but it won't go away. With type 2, you can affect the health of your receptors by changing your eating habits and changing the amount of stress on that receptor, where in some cases, people who have lost a considerable amount of weight have reversed their diabetic numbers, right?
That's true.
Huh?
That's true. That's true.
Yeah.
Yes.
Mm-hmm.
So speaking of stressors onto your system, one of the common stressors you often hear about is sugar.
Mm-hmm.
Okay, and so tell us a little bit about the impact sugar has, because I know that we're living in a society now where sugar is ubiquitous. I mean, it's
Oh my God.
everywhere. And
Everywhere.
yeah, and according to the American Heart Association, I remember looking this up, they want men to get no more than 36 grams of sugar, and
Right.
women are restricted to or advised to limit their intake to about 25 grams of sugar a day. But
Correct.
one can of Coca-Cola has 39 grams of sugar. So
Correct. Correct. Exactly. And I was going to show you this little analogy that I put together, because when I talk about it, people often can't even fathom that they're taking in that much sugar. But as you said, there is sugar in everything. Sugar is used as a preservative, but it's also used to enhance the flavor. A lot of the processed foods have sugar in them. They put high amounts in so that, well, as it sits on the shelves, and you go and you buy it a week or a couple weeks or a month later, that it still tastes palatable enough to make you want to continue to come back and buy it. That's all a part of the processing, right? So sugar toxicity is a thing. And we have been programmed, our palates have been programmed to crave sugar, right? If you ever have tried to stop eating sugar, or you go on a sugar fast and that kind of, you get the headaches and you get all this because your body is used to it and craves it, and you end up craving it. It emits that whole feel-good hormone, the dopamine feel-good hormone. So unfortunately, marketing doesn't help with all of the food and the way they enticed you. Every other commercial was a food commercial, especially if you're dieting, right? Everything on TV is about food, but it helps us to be informed. It's okay to indulge every now and then, but it does help us to be informed. Sure. And yeah, 25 grams, 38 grams, that's a hard and tight number when you think about it in totality. So I'm just going to share my screen here and show you that on average, the average adult can get 150 or intake without even thinking about it, 150 to 170 pounds of sugar in a year.
Wow.
In a year. Allow me to share my screen and I'll show you how it goes. Let's see. All right, and I'm going to put it in presentation mode. Oh, went the wrong way. So yeah, so like I said here, the average American consumes 150 to 170 pounds of sugar a year. That roughly breaks down to about 1/4 to 1/2 pound of sugar a day. Let me show you how that can happen. So you have 30 to 60 teaspoons of sugar, right? That's in a 24-hour period. If you take in 30 teaspoons of sugar, that's 1/4 pound within 24 hours, right? 120 teaspoons equals 1 pound of sugar. 1/4 pound of sugar is 30 teaspoons. 1/2 pound of sugar is 60 teaspoons. You follow me? So in a 12-ounce can of soda, just a 12-ounce can, you have 8 teaspoons of sugar in that one can. Let's say you drink 4 cans of soda in a 24-hour period, right? That's your 32 teaspoons. 30 teaspoons is 1/4 pound. So you see how easy it is just by drinking soda.
And that's not counting other things that you're eating. And
not even. We haven't even considered the other foods yet. All of which, if they're processed, are loaded with sugar. More teaspoons than this. And that's not even talk about supersize. Your 16, 24, 32 ounce gulps. Forget about it. And that's just drinking. And by the way, drinking calories is the fastest way to put on weight. Because it's so easy, right? And you don't realize, you just drink. You have one for breakfast, you drink one mid-morning, you have one for lunch, mid-afternoon, maybe another one for dinner. If you drink soda all the time, and even many of the fruit juices, and people think, oh, fruit juice, fruits are healthy and good for you, and this kind, and fruits are, but when they add added sugar, it's the added sugar that we are concerned about. So as you alluded to earlier, American Heart Association recommends 6 teaspoons a day for women, 9 teaspoons for men. But of course, we probably get so much more than that. But that's just something to be mindful of. And again, as a diabetic, very, very important to monitor that. So I implore people to start reading their food labels. Read your food labels. So then you know exactly, because now they've changed it. Michelle Obama has, while President Obama was in office, she and Congress, they redid the food labels because they found that the processed foods that we were eating led to the epidemic of obesity. And so, I mean, I could go on and on and on, but I just wanted to share that with you guys as far as sugar goes, just to be mindful and to know that, you have to, it will sabotage your weight loss goals, sabotage your dietary control over your diabetes and other illnesses if you're not mindful.
And the unfortunate thing is you do have people who are trying to lose weight, but they don't find, they're not realizing any results. And so demoralized, they stop trying.
Right.
The old why bother? I'm only, just going to gain weight, but they don't realize just how much sugar is hidden in some of the things, even the healthy foods like you had, on your list there, they'll advertise protein,
right,
but they're packed full of sugar. They're packed full of everything
exactly
else.
Exactly. Yeah. Especially like your low fat, people think low fat or diet. Be mindful, again, read your nutrition labels, because they'll remove the fat, but then they add more sugar because it still needs to taste palatable enough for you to want to buy it. Right. A lot of our fruit added yogurts. People think, oh, I'm on a diet, I'm eating this yogurt with the strawberries in them, with the berries in. When they add that fruit, they add sugar. It's not just the fruit. They've added sugar. Because, a lot of times we might get certain kinds of blueberries, blackberries, and it may not be as sweet.
Mm-hmm.
So they add sugar to make it palatable and also to help preserve it while it's, in the grocery stores.
That's true. And, for those, because I know there's a little bit of confusion with this, but people have to understand that fruits, the actual whole fruit, such as the apple or the orange, they're often packed full of fiber.
Yes.
So
definitely.
Compared to the fruit juice that you get at the store,
right,
which is just giving you all of that sugar without any of the fiber.
Correct. And that's the thing. And that's the whole thing with people who are into the practice of juicing, and I don't knock that. If you take the fiber or you take the pulp that after you've juiced and gone through the machine, and maybe use that, putting it in some muffins or, making it into a smoothie or doing something else. I usually say do a smoothie because, then that way you can get all the fiber and the vitamins and minerals and things from the actual fruit itself, as opposed to juicing and squeezing everything out. But, it becomes a personal preference. But yeah, if you juice at home, at least you're doing something better than buying the juice from the grocery store with the added sugars in it. So, just a little food for thought.
Well, thank you for that. So now you've just been diagnosed diabetic, not you per se, but this hypothetical patient. He's just been diagnosed diabetic. What are some of the symptoms that he or she or they can expect to experience if they don't manage your diabetes properly? I know that thirst is one of the more common symptoms, but what are some things that they can expect if they don't, do a lifestyle change or maybe adhere to some, medications that are prescribed?
Okay, so yeah, early on, perhaps even if you're diagnosed with prediabetes or diabetes, people may experience symptoms, like you said, of excessive thirst, increased urination. You might be fatigued. You might have sores or wounds that don't heal as quickly as they normally used to. So those are some of the early on symptoms that people might develop: numbness or tingling in their fingers or in their toes or extremities. Those will be signs that, okay, hey, something is wrong. And your body better than anybody. And so if you note that you're developing certain symptoms, it's just not right, or you can't explain it, then I would say go see your doctor so you can be tested. But after you have been diagnosed with diabetes or even prediabetes, and if you don't do anything towards improving what got you to that situation, then the dangers will continue. And then so your body is still in glucose or carbohydrate toxicity overload. And that inadvertently affects your blood vessels, where you end up with blindness. So problems with diabetic eye disease, you get blindness, cataracts. With your kidneys, you get kidney failure. With your extremities, you can get peripheral vascular disease or development because, again, the blood vessels are affected. So blood flow is not sufficient.
Mhm.
And ultimately, in time, that causes, necrosis or gangrene. And then you get your legs and feet and limbs amputated.
Mm.
Yeah. And so that's why you have an opportunity to affect your long-term outcome. And it's getting the information and then utilizing it to your advantage so that you can prevent a lot of those complications from developing.
Wow.
People
Wow.
develop diabetic neuropathy, where they have, pain in their legs because the nerves are affected because of the sugar, toxicity. So many different things that, again, you don't have to suffer. We all probably have family members or friends or neighbors down the street who we know, oh, they had the sugars, or they had diabetes. And, oh yeah, Mr. Johnson, he had his leg cut off. Yeah, he got the diabetes. And it doesn't have to be that way. Mm-hmm. It does not have to be that way.
Wow. And, I'm glad you say that, because one of the most common things that I've heard from patients and people, is that it's genetics, right? So I have this disease because it's genetics, because, somebody in my family had it. And what's funny is they'll pick somebody, just some random person that is somehow related. My cousin's brother's second son, had diabetes 10 years ago, and I got it. And somehow they are, they got it from them, or because they share the same distant bloodline. But, I'm glad to hear a physician saying that, no, it's you have a choice. You have it within your power to stop these things, or from even getting to the point where you're going to get your foot amputated or get on a dialysis or something like that. So, it's wonderful to hear that. Now, with all these complications that, that people are facing, in your book, you talk about a 7-step diabetes management plan. I was wondering if you could share that 7-step plan with us.
Yes. So you want to definitely make sure that you build a support group. Okay. So once you get the diagnosis, build yourself a support group. And that would be your family members. You incorporate them into helping you out, because living with diabetes is a hard task, but it's doable. Right. But again, you'll need support, dietitian, your primary care physician, your ophthalmologist, because you want to be checked for diabetic eye disease on a regular basis. If you have a dentist, again, a primary care doctor can orchestrate a lot of different things where if he finds that there's some failure in some of your organs, then they can, refer you accordingly. So again, just building that support team, a counselor or a therapist, because again, some people get the diagnosis and they're depressed, or they don't know how to, process that or deal with it. So building a support team, getting informed. You want to make sure that you get informed. You inform yourself on everything. So you just got this diagnosis of diabetes. You want to inform yourself on everything that you need to know about it. You want to know how the medications affect you. You want to learn and know how to eat the proper foods. You want to learn as much as you can to improve your health, right? Lose weight. Lose weight is another one where, again, it has been shown that most adults who end up developing type 2 diabetes are overweight or obese. And so even losing a little bit of weight, 5% of your current body weight, could greatly affect your hemoglobin A1C numbers and take you from either the diabetic range to pre-diabetic, or from pre-diabetic range to no diabetes.
And that's the number. Hemoglobin A1C is the value that determines, essentially gives an illustration of your blood sugar control. Am I right?
Yes, yes, and it is a 3-month average. So hemoglobin A1C, it stands for glycolated hemoglobin, and so the hemoglobin is the part of the body that carry a part of the blood cell, excuse me, that carries the oxygen, and glucose adheres to that, and that's why it's glycolated hemoglobin. So it adheres to it. A red blood cell may last for anywhere from 60 to 90 days. So then that's why over a 3-month average, that hemoglobin A1C number will let you know how much sugar has been in your bloodstream over those 3 months. That's what they look at in the lab when they determine that number. And so you have less than 5.7 or 5.4 to 5.7 is pre-diabetes, right? I'm sorry, is normal. 5.7 to 6.4 is pre-diabetes, and then above 6.4 or above 6.5 is considered diabetic.
Okay, excellent, excellent. Yeah, so that's, for someone who goes into the doctor's office and they tell them what their hemoglobin A1C level, C numbers are, that should really explain that, because sometimes people just have a number, they have a numerical value, and they don't know what to do with it. What does that mean,
Right, exactly. And that's what I mean about asking questions, though. What are you talking about? What does this mean? But that's the explanation, and that's what you should get. People should know and readily know, because I'll often ask you, well, what are your numbers? And you should know what that means when I say, what are your numbers if you're a diabetic?
Right.
I'm talking about your hemoglobin A1C. So, it was 6, it was 7. I've had patients come into the ER with 14, 15s.
Wow.
Yes, which is diabetes out of control. And that is just a complication waiting to happen.
Wow.
Yeah.
Now, what are some other ways, some other steps, please?
So you want to focus on food. That means focus on the right foods. Which foods can I eat? Which foods are harmful to me? And there's different ways to go about it. I'm not saying start any kind of fad diet or anything like that. It's a matter of, okay, now I'm going to incorporate more whole food, predominantly plant-based, because it has been shown, studies have shown that people who have even gone vegetarian or vegan have greatly improved their outcome as far as type 2 diabetes. And some of them have even reversed it to where they no longer have numbers higher than 6.4. They're usually hang out in the 6s, or high 5s.
Wow.
But that's because you're not eating all of that processed excess added sugars. You eat mainly predominantly, because even people who are vegan, so even the dairy, your cheese and your dairy products have a lot of saturated fat in them, which leads to other problems. So again, you just want to be mindful of the foods that you eat and how they can help you as opposed to hurt you. You want to get active. So developing an exercise program or some kind of physical activity regimen, get a workout buddy, get a group of girlfriends, you can walk around at lunch, or however you incorporate whatever activity you like to do, then you need to do that, because that goes a long way to helping you burn calories, helping your body use insulin more effectively. And it just improves your overall outcome as far as diabetes and other illnesses go, and just improving your health, altogether. So getting active is another one. Getting trim, again, that's the whole losing weight kind of thing. But you want to also make sure that you get ready. So you want to kind of develop that diabetic mindset. And what does that mean? Well, I have diabetes, but diabetes doesn't have me. So then you make your mind up that day that you're going to do what you need to do to be around for however long God grants you, right? So you identify your why. I often tell my clients and patients, identify your why. Why is it that you want to live a healthier life? Why is it that you want to take control of your health? Why do you want to beat this diabetes? Is it, you have a grandchildren, your spouse, your children, upcoming wedding, you want to graduate, whatever the case may be, identify your why, because often when it gets hard, and it does, And we all fall off the bandwagon. I fall off the bandwagon. I fell off, not too long ago.
The
But we
holiday.
pick ourselves up and we get back on.
That's
Right?
right.
Because it's a daily struggle. Living with diabetes is a daily struggle because you have to make the choice. Do I want this piece of cake or do I want this apple? You know what I mean? And in certain situations, because eating is social, it might be hard to make those choices and decisions. So, but again, that's where when I loop back to the support system and everybody else being in your corner, and behind you, helping you along the way, then that goes a long way in helping you remain and, get to and remain successful. You want to manage your stress, right? Because stress, again, is inflammatory to the body. So you want to make sure that you manage your stress. Yoga, meditation, reading a book, going away into a quiet place in your home, reading your Bible, praying, maybe just sit, whatever it is to de-stress, getting a massage, because that goes a long way too in helping you deal with all of the stress of managing diabetes. Because nobody knows but you when you're going through it. You can talk and share things with people, but you truly experience it. And so some people internalize the stress and don't talk enough or let it out. So those are some of the steps that I think are very important. But getting informed, most definitely, is a great start. Again, knowing, when I say getting informed, I mean getting informed about diabetes as a whole, and understanding. So we have to continue this dialogue. November is Diabetes Awareness Month. That's coming to a close, but I think we should continue the dialogue every day, every month, all year.
Well, and I agree. I agree wholeheartedly,
Yeah.
Doctor. I mean, you're looking at about, last time I checked, about 11% of American adults are considered diabetic. And they estimate that 1 in 3, because you have to factor in the 88 million that are pre-diabetic.
Correct.
So you've got 10% diabetic right now. You've got 88 million that are pre-diabetic and are on their way to being diabetic.
Right.
So they're saying that, within a decade or two, we might see 1 in 3 adults being diabetic in this country.
Oh yeah. If people don't take a stance now and start doing something about it, see, we need to be the change now for the future generations. When people say, oh, well, it's genetic, not really. No, let me take that back. Yes, it can be. However, what it more so is, as opposed to genetics and the genes and the DNA, is the cultural habits that have been passed down through the generations, the way that we eat, the soul food dinners in celebration of various events. Everybody brought, the potluck. Who brought the mac and cheese? Who got the candy yams? Who has a peach cobbler? And who bring, all of this, that, and the third, right? That's how we have been raised and what we did when we celebrated and how we ate. Well, how it's prepared, how many pounds of sugar goes into all that stuff. But it's good, right? It's good. That's what we know. That's hard to say. People, oh, you can't eat that. What do you mean? Right? So that's hard. But that's the generational eating habits that have been passed down. So when people say it's genetics, it's not necessarily totally due, especially type 2 diabetes and the obesity epidemic. It's not, we have become less active as a society. And when I say intentional, again, you have to be intentional to say, I'm going to get up and go and walk after work every day, or I'm going to make sure that I exercise 4 to 5, 6 times a week. That's intentional. And it takes effort, right? Because again, we are not as mobile as we used to be. We don't walk places anymore. You got electric bikes, electric scooters. You have vacuums that vacuum the floor for you, these little robotic circular things. I even have one. The remote control, you only have to get up and turn the TV, everything's electric or technology driven. And so we don't move as much as we used to. So you have to be intentional to get your workout or get your calorie burn in.
Now, I'm going to give you a scenario because I grew up in the church And so some of the things that you're saying, I lived it, I experienced it growing up. Okay. And, my hometown, North Greece Road Church of Christ, some of the members have joined us for this podcast.
Okay.
Now I'm in Westchester Church of Christ. So, I'm sure they're going to give me a nice talking to after this, but I want to give you a scenario.
Yes.
Right. You have a church event, thereafter you have a church potluck. Everybody brings in stuff. You got the sweet tea and all these different things.
That's right.
But then you say grace that the Lord turns this into, something that's going to nourish our bodies.
Right.
I want you to go into that mindset a little bit, because I go hard on my people because I care about them. It's not to criticize them out of malice, but it's to bring to light certain habits that, that are detrimental. And not necessarily saying my congregations are doing this or anything like that, but it is, many a times found in African-American communities and church activities.
Most definitely. Most definitely. And so, because again, we are entrenched in our traditions, and traditionally, even in the Black church, we eat. And we eat what is prepared, and what is prepared is how we were taught it was prepared. And it may even go, way back to slavery, where, there were festive events and people prepared, or the slaves prepared great meals out of what they were given. So they were given the undesirable parts of the pig, the chitlins, right? Because the masters, whatever, didn't want to eat that, so they took the chitlins and redid it and made it into a gourmet delicacy in our community, right? Sweet potato pies, they didn't really, they had to grow their own, fruits and vegetables. So they would take the yams and make them into candied yams and make them into sweet potato pies and these kind of things. Your greens, they would throw in the ham hock, right? Because that was the only piece that Master gave them. So I'm saying all that to say, and then these traditions are passed down over time. So, unbeknownst to a lot of us, again, unless you're kind of educated or informed on the nature of the food that you eat and what goes into it and all that kind of thing, you're just going with status quo. So it pays, again, to learn, to know what you're eating and why, and the history behind it. And especially if you are subjected to these chronic diseases or illnesses that are developed as a result of our eating habits, then people aren't compelled to make a change. Like you said, they pray over it. You know what you're eating. Now, if you know what you're eating is bad and you keep eating and you're a diabetic and you shouldn't be eating it, yet you're praying to God to help you, well, that's kind of hypocritical. Because you know what to do, you just choose not to do it. And you say, oh, Lord, I pray you just heal my body. But did you do what you need to do? Because the Lord can help us, but we have to help ourselves too.
Amen.
Yeah.
Amen. Very well said. And I love that coming from a doctor, because it's a theme that I often harp, with these podcasts, with some of the topics that we've covered. And, that and the fact that, one thing that seems to be very common with all of my guests is the emphasis on plant foods or a plant-based diet. And it seems almost foreign to hear that these days, because, everything has not just sugar, but, everything is meat and processed and everything, where it almost seems like, what do you mean eating plant-based? Like
right.
what does that even look like for the average person? But, and I'm guilty of that too, because I know that it's not easy to incorporate, it's not easy to change something you've done all of your life. Let's just start there, right? It's just not something that you can just do like that. But I like that your first step in terms of diabetes management is to find a support group, because I find that with a group of friends or with a group of people who believe in you or who keep you on track, you can do anything.
Right. Absolutely. You just have to want to.
Mhm.
And even, yes, we have typically over time somehow gotten to that notion that we have to have meat with every meal, breakfast, lunch, and dinner. And we really don't. People think, oh, well, if you don't eat meat, you can't get your protein. But you can get ample amounts of protein from eating fruits and vegetables, ample. Just think about those animals, even the cows that you eat. What do they eat? Grass. The giraffe, what do they eat? But look how big they are, right? They don't eat meat. So you don't need meat, but the meat packers and warehouses and farmers, paid XYZ in the marketing, and it just has you conditioned into thinking you need meat with every meal. So starting off, yes, it's difficult. People say, oh, I just need that texture. I just need it. But now because I am a pescatarian, most of my kids are vegan, right? And so I ended up cooking more vegan like. And they have out now, because it seems more and more people are getting on board with it, which is great. But they have a lot of meat substitutes.
Yes.
So, Beyond the Beef, Impossible Burger, Gardein, Morningstar, everyone has their own take, and more are coming out every time you turn around on meat substitutes. So you can try, and you have to get creative with your meal prep and everything else. But I use the meat substitute crumbles, like when I make spaghetti or tacos or chili, and you can really hardly tell the difference if it's seasoned appropriately and that kind of thing.
Mhm.
But it's a process, and you have to be intentional. And again, identifying your why would keep you probably more so on track than not.
Thank you for sharing that. Thank you so
Mhm.
much for sharing that. Wow. Now, what about somebody who's just been diagnosed and they walk out of there? Many a times they're probably started on something like metformin
Mhm.
or another oral,
Mhm.
you know, uh, medication for them
Mhm.
to one movie or something.
Mhm.
What do they do if they want to, if they're looking for something different? Because I know a lot of people are always looking for herbs and supplements and everything like that, maybe just to sort of give their bodies added help in terms of managing the helping the insulin work a little bit better. But are there any supplements or herbal products that you can recommend would be helpful to somebody who is diabetic and just looking for something more than just taking a pill every day?
Yes, there are quite a few herbs and supplements that are out there. Again, more studies need to be done. There's only been, a small number of studies on these different vitamin supplements. Some have shown great promise, but it's not to say that this is in lieu of taking the medications you've been prescribed by your doctor. All of this is just to enhance, on your healthy eating journey. And so Vitamin D3 is a good one to maybe start taking. If you don't take a vitamin D3 pill, then it might be beneficial to you to do so. Vitamin D helps as an antioxidant. We find that we don't get enough vitamin D, lately, again, because we're indoors a lot, or we're wearing clothes that cover us up, and don't really get out in the sun much. We might be working long hours, especially now, with daylight savings, right? Daylight savings causes it to get dark early. So we miss that sun. And so vitamin D helps with improving insulin resistance. And so it helps your body utilize insulin a little better. Right. So vitamin D is a good one. Another one would be cinnamon. Cinnamon has been shown to help with decreasing the blood glucose level or the blood sugar, decreasing hemoglobin A1C, and helping, normalize your sugar levels. So I think they make cinnamon tablets, which you could take, and if you chose to just do that, or if you want to sprinkle cinnamon on your foods, put it on your oatmeal. It's just the little things. Put it on your oatmeal, put it in your smoothie, on your yogurt, different stuff like that, just to enhance the flavor And yet cinnamon has been shown to be able to help with improving your blood glucose. And then green tea. Drinking green tea is a great way to help boost your metabolism. That helps to, green tea is also a great antioxidant, and it helps, and I'm sorry, I misspoke. Vitamin D is not an antioxidant. Green tea is an antioxidant, but again, it helps to increase your metabolism.
Now,
Antioxidants, pardon?
Go ahead, please. I'm sorry.
Antioxidants help because it helps to combat free radicals, which ends up being oxidative stress. And free radicals happen when there's too much sugar in our blood system. It's an inflammatory process. When you get free radicals, those free radicals attack our cells, right, and cause damage within blood vessels and things like that. And so that's why antioxidants are good, because it helps to combat the foreign invaders, which are the free radicals, helping your immune system and the like, helping you heal from illnesses and disease processes.
Wow.
Sorry, that's all I was going to add.
No, that's perfect. Wow. Thank you for clarifying on that. To those supplements, could we add fiber? Because I know we mentioned it a little earlier, how because we're drinking juices that have been separated from the actual whole fruit, we're missing fiber. Would adding fiber to our diet play a role in terms of helping to just with that blood sugar balance?
Absolutely. Fiber is a diabetic's best friend.
Okay.
Fiber is everybody's best friend, basically. And you can only get fiber from fruits and vegetables. Now, they do have fiber supplements that you can add, the Benefiber and the Metamucil and different things that you can add to water. But a better way to do it is to do it naturally with whole fruits and vegetables. And whole just means that it came straight from the tree. Not literally, of course, if it goes through the grocery store and it's that kind of thing, but that it's not processed. So basically you have a whole apple. That's a whole fruit, as opposed to sliced apples that are in juice with sugar and then on the shelf at the store. Right, so whole food is basically undergoing as least the amount of processing as possible. But yeah, no, fiber definitely helps in so many ways, to decrease your blood sugar. It makes you feel full. You get full faster, you eat less, right? And it just helps to overall make you regular. So your bowel movements are great. It just helps combat so many different things. That yes, fiber is or should be our best friend.
Very well said. Now, part of your book, Get Informed, there's a section that talks about making time for the diabetic lifestyle. What does that look like?
So what that looks like, again, is you've made your mind up. Because so many times we say, oh, I don't have time. I would work out, girl, but I don't have time. Or I would do meal prep, but I don't have time. I say it like this: we make time for what we want to make time for. And if you are important enough to you, as well as others, your family members, your friends, then you'll make that time. You make the mindset that, okay, I have this diabetes. Now, what am I going to do with it? How about I reverse it? So then make that your life mission to do whatever it takes. And again, it's intentional. It takes work. It takes time. And you might have to sacrifice and do something else or do something different. If you need to get in, so they advocate that we get 150, at least 150 to 300 minutes of moderate to vigorous exercise per week. That roughly works out to 30-minute sessions, maybe 5 days a week. Or you can 45 minutes to an hour, 5 days a week. Great. But you have to be intentional with that. So I don't have time. I get up and I go to work and I do this. And when I get off, I got to do that. So did I, right? So if that means you have to get up a little earlier or sacrifice doing something else, maybe you can't watch TV. Or if you do, work out while you're watching TV, your favorite show. But you just have to manipulate your schedule and make your mind up that you're going to do whatever it takes to be intentional about getting and staying healthy. That's what that means. Because again, so many times people will say, I don't have time for it. Well, will you have time when you're in the hospital with your leg cut off? Then you won't be able to run errands like you used to, right? Or will you have time when your kidneys have failed and you got to make time now 3 days a week to go to dialysis or, in order to sustain life? Will you have time then? So make time now so that you don't need to take time later.
Wow, perspective right there. That's perspective. That's perspective. So
Yeah.
how does one live their best lives, as a newly diagnosed diabetic?
Accepting your diagnosis, recognizing that diabetes is a serious illness. You don't have to look far. You know somebody, some family member, uncle, aunt, grandmother, grandfather, big mama, somebody has had diabetes and either didn't manage it properly or has had a negative effect because of it. So living your best life will be recognizing, okay, I have this disease. Now, what am I going to do? Because you can go on to live a very fruitful and healthy life just by making some minor lifestyle changes. But you have to be committed to it.
Commitment indeed. So one other thing that's interesting was when I looked at the breakdown of the 34.2 million million American adults who were diabetic, it broke it down by saying about 27 million of those of them were diagnosed as diabetic, and about 7 million were undiagnosed. So
Exactly.
you have millions of people walking around with diabetes and they don't know it.
Don't even know they have it. Don't even know they have it. Because diabetes, like hypertension, is the other silent killer, right? People walk around with blood pressures in the 200s and don't even know it because you don't feel anything until it's too late. When you're having this splitting headache or loss of sight or your mouth is twisted and that because you're having a stroke. Because the damage has been taking place and then it just hits. Same thing with diabetes. The damage has been taking place over time. So, like I said, this whole obesity or overweightness epidemic, and people tend to put on more and more pounds, more and more pounds. Well, that's, the sugar is building up and your insulin is not working, your receptors aren't working. And then over time, because there's so much sugar, it has that effect. And then when you start having the symptoms, the effects, the damage can be reversed, but some of the damage is done. So that's why it's important to go to the doctor regularly, right? Go to the doctor if you feel like you're having symptoms for something to get it checked out. But by going to the doctor regularly, they're taking your numbers, they're letting you know where you stand, this kind of thing. You know what your cholesterol is looking like, you know what your blood sugars are looking like, and you can do something about it. But if you're young and you're healthy, or even if you're older and you're healthy, by adopting positive and healthy lifestyle habits, you can prevent having to even develop or deal with any of the prediabetes or diabetes and or complications. But yeah, 7 million people, I was one of them because I didn't know I had it. After I knew I had the gestational, because I was going to the OB and she checked me out and did a sugar test and all that. But then walking around after that, I'm feeling fine. I just decided to stop trying to treat myself and let me go to a doctor. So I went to the doctor and my doctor said, your hemoglobin A1C is elevated. I think mine was 7.3.
Oh, wow.
Yeah. 6.5 and above is diabetic. So I was like, who, me? No, I don't have diabetes. Said, yeah, we want you to take this metformin. You got to do this, that, and the third. I ain't taking no medicine. This is me, the doctor, the worst patients ever. Right. But I said, I'm going to eat right. I'm going to exercise. I'm going to drink more water. Now, mind you, I had been doing all that. So I thought. But again, if you don't know or take the time to know that this food is sabotaging you and not helping you, you think you're on the right path. I'm on this diet, girl, and I'm eating that, all the Atkins and ketos and all this. It's too much saturated fat. And you're killing yourself on the inside. You might look good on the outside. So that's why it's important to eat those foods that are going to help you from the inside out.
Wow. Well, thank you for sharing that story. Thank you for sharing your story and your experience. And that's something that I've commonly heard, that doctors make the worst patients.
Oh, God. You don't want to listen. Can't nobody tell you nothing.
Wow.
Can't nobody tell you nothing.
So Dr. Sharita Warfield, for those of us who want to get in touch with you, not just those in the podcast right now, but those who will watch this video later and they want to get in touch with you, maybe they want to learn about your book or get the book, get informed. How can they reach you? How can they get in contact with you? How can they follow up and stay in touch with your work?
Okay. Well, they can send an email if they'd like. You can send an email to info, INFO, at Dr. Sharita, MD. That's DrSharita, MD.com. That's my email address. I am on all social media sites at Dr. Sharita, MD. That's my handle. In order to get the book, if you want to get the book on diabetes for yourself or a loved one, a neighbor, that make great Christmas gifts, I'll give you a personally autographed copy. You can go to www.getinformedbook.com.
Getinformedbook.com. Now, for those who are just joining us or for those who are watching this video, once it's been posted on YouTube, I just want you to know that we will include the links to everything Dr. Sharita has mentioned in the discussion. So it'll be in the information section of the video. So all of these links as well as her contact information will be posted down there. So you'll have the opportunity to go directly to the website and purchase her book, visit her website, and even follow her work. And of course, you can send her an email should you have any questions. So Dr. Sharita Warfield, I want to thank you for joining us this afternoon. It's been such a pleasure hearing it from a physician, but also someone who's lived it, who's experienced a lot of these things that we've discussed regarding diabetes. I want to give you the final word, just to sort of say anything that's left that's on your heart to share with the audience, and then we're going to go into Q&A.
Yes, sir. Thank you very much, and thank you so much for having me. Again, it has been my pleasure to share my knowledge, to share my gifts with you all, and hopefully, again, you've taken something away from this conversation. It is just vitally important for us now more than ever to take control of our health, to be intentional, to make positive and good choices and decisions, make, the proper lifestyle changes, because we only get one body, right? So if this one's messed up, where are you going to live? So it is key, vitally key. Drinking more water, eating more fruits and vegetables, try incorporating a piece of fruit or vegetable in every meal, right? Theoretically, so there is a plate method that I'll share with you. So you have a circular plate, right? Divide that plate in half and then divide it in fourths. One half of that plate should be filled with fruits and vegetables, mainly vegetables, right? But fruits and vegetables, one half of the plate. 1/4 of the plate is your protein, if you must have it. And it doesn't necessarily have to be meat, but if it is, you do 1/4 serving. And then 1/4 is a healthy grain or healthy carb, sweet potato, brown rice, that kind of thing. So try that along with portion control. Exercising portion control is key because, again, we're being sabotaged by these restaurants with these super sizes or buy one, get one free burger meals and all this kind of stuff. And, so it's just important to, again, make the proper choices and ask yourself before eating that piece of cake, that candy, or that sweet potato pie, is this good for me? And if you decide to eat it, that's fine, because moderation is okay too. You can treat yourself, but just know, okay, I'm gonna have to walk an extra half a mile, or I'm gonna have to really get it in, or I'm gonna have to cut out something else, along the way. It's not gonna happen overnight. Developing that mindset, understanding, educating yourselves continuously, reading food labels, shopping the perimeter of the grocery store. I could go on and on. But these are things that you can do to further improve your health and improve your quality of life. Because ultimately, we all just want to what? Live our best life. So let's do it. Let's get on this journey together. Thank you again so much for having me. It's been my pleasure.
Amen. Thank you, Dr. Warfield.
Listen to the audio version of the Self-Care Forum podcast on Spotify, Apple, and Google Podcast.